All right, we're going to go ahead and get started then. I just again want to welcome everyone to the Penn State University Press webinar entitled Comics, Clinics, and Public Health. I am delighted to be moderating this discussion about 3 exciting new books in the graphic medicine series. I am Brian Callender. I'm an internal medicine physician at the University of Chicago, a graphic medicine enthusiast, educator, and scholar, and a co-editor of the graphic medicine series at Penn State University Press. Today we will be talking with several authors of these three new exciting works. We'll be talking with Lesley Hughes and Patricia Nguyen, 2 of the co-authors of Looking at Trauma, a Toolkit for Clinicians. Then we'll be talking with Meredith Lee Vollmer, author of Graphic Public Health, a comics anthology and roadmap. And then we'll be talking with Kimberly Myers, Molly Osborne, Charlotte Wu, who are authors of the Clinical Ethics, a Graphic Medicine Casebook. Okay, so what I'm going to do is ask each group of authors to tell us a little bit about their book. And after that, we'll be opening up for discussion and we'll be taking questions. You can submit your questions via the Q&A button at the bottom of your screen. And you don't need to wait until the Q&A session to do so. Feel free to do your questions as they come up, and we'll try to get to as many as we can in the time allotted. If your question is for a specific author, please note that, and we'll do our best to get to as many of those as we can as well. And so first, I'd like to introduce the first book that we're going to hear about is going to be Looking at Trauma, a Toolkit for Clinicians. And this was authored by Lesley Hughes, Patricia Nguyen, along with Abby Hirschler and illustrator Shelley Wall. So a little bit about Lesley. Lesley is a registered social worker with an adjunct lecturer appointment at the Factor Nguyen Faculty of Social Work. And Patricia is a medical illustrator who studied in the Biomedical Communications program at the University of Toronto. And with that, I will turn it over to the 2 of you to talk about your work.
Thanks, Brian. Well, thank you for that warm welcome and your presence, everyone's presence with us here today. So I think we're going to get started with a screen share, but while we do that, perhaps we'll just start by saying, I'll tell you a little bit about how I came into this project myself as, with a lot of curiosity and clinical experience, but not a lot of experience with graphic medicine. So thankfully for me, our co-editing team came together beautifully with our various skills and strengths, and I'm really honored to be presenting here today and with you as well, Patricia.
Yes, I'm very excited as well. So let's just hop into it. This is our book, Looking at Trauma, a Toolkit for Clinicians. And just before we start, this was not just me and Lesley. There was a lot of people that contributed to this work. Our co-authors and editors, Abby Hirschler and Shelley Wall, and then the entire Women's College Hospital therapist that was part of this program. So big thank you to them for contributing to the book.
So a little bit of history in how this story came to be. Myself and my colleague Abby, we work in a mental health department. We work in a publicly funded hospital, and in that hospital, we have a specialized trauma program. In that program, we work with adults, but adults who have experienced chronic and often repeated trauma under the age of 18. And what we mean by trauma in this case is anybody who has experienced emotional, physical, sexual abuse, witnessing violence, and neglect. And that we're experiencing symptoms and challenges as a result of that trauma, and also often came in with symptoms consistent with complex PTSD. So, as people may know, both here on the panel and in the audience, we work in a publicly funded downtown urban setting. And in that setting and environment, we experienced the all too common tension between having a significant demand for services with hundreds of referrals a month, and that demand outweighing really our capacity to provide the care that people need and deserve. And often that limitation was in the form of human resources, just not having enough therapists, not having enough clinicians doing this specialized trauma work. So that meant that we had, if you could just go back one for a sec, Patricia, thank you. So that meant we had this pressure. You need to do more with less, you need to do it faster. And what we realized was that people were, when they came into our program, the clients were really eager and relieved to be there. And as we started to chat with them, we heard a long story about getting into the program. And what it often looked like was, you know, people saying that they had been looking for help for years, maybe being turned away because the therapist they were seeing doesn't work with trauma, maybe trying to disclose the reason between a physical health problem and thinking that the connection might have been due to the trauma they experienced, but the provider becoming uncomfortable, cutting the appointment short. And so we had a lot of people who were grateful to be there and motivated to be there, but had spent many years trying to get some support around their trauma. And so we decided, you know, comics alone aren't going to be the solution to demand resource discrepancy in public health, but we were eager to imagine a world where all humans actually had access to trauma therapy, some kind of basic trauma understanding. And, you know, I think as a team, we were already feeling the weight of the moral distress that comes up, and the pandemic was looming. So we decided we could start to put some creative energy into this idea of designing a toolkit, a clinical toolkit for individuals, healthcare professionals, such as therapists, physicians, maybe chaplains, social workers, personal support workers, nurses, whoever it may be, to help build their community capacity around addressing trauma. And to do that, we thought we should start by asking, what is getting in the way? What are the barriers for clinicians and their concerns when working with trauma? And so here's some information that we got from people that clinicians in the field, healthcare professionals were experiencing, you know, several barriers, feeling like they didn't have enough training. Maybe they had similar experiences, perhaps feeling like they actually couldn't relate. Fears around burnout and vicarious trauma, knowing that with trauma comes a lot of secrecy. And so am I going to be able to help someone? Am I going to feel emotionally burdened and overwhelmed, helpless? Maybe people's own shame getting in the way and resistance getting in the way. And so what was interesting is that when you look at what comes up when people have experienced trauma, we've just put a few of the impacts and symptoms up here. But they're kind of similar, right? When we look at what some of the worries are around dysregulation or emotional overwhelm, irritability, mistrust. A big one that we're highlighting in the book through a lot of the different models is this idea of difficulty in relationships and how those foundational patterns of, you know, the first group you grew up in, the first group of people you grew up in childhood, if those relationships were tense, how then did those difficulties come up in later in life in relationships? And can we help people understand that?
Right, so here comes a part where we make comics. So with my prof, Shelley Wall, she got a grant and we were gonna make for graphic medicine. So we're gonna make this project, which cascaded effect towards Lesley and I working together amongst other therapists, but Lesley is the first therapist I met. And so we would talk and she would explain to me the models. And then I would ask her back questions, just trying to pick on words that like what the clients were feeling and what challenges they had explaining the models to the clients, because these are based on psychotherapy trauma models. And then based on that, we had an iterative process of me trying to visualize the model and then coming back and then be like, oh, it's not quite like this. And we're trying to like, it was like a team effort to try to get a good balance of visual metaphors, but also communicating the right message. So how do comics help in clinical psychotherapy? So the wonderful thing about comics is that there's words and there's images, but not only are those combined, there's a third magical thing that happens. So there's a narrative that comes out. There's time that you can express via panels. So was a really wonderful thing that could be used for therapy. It also, with the comics and the characters that we've designed, and the visual metaphors and maybe funny anecdotes, it helps make this topic that's quite abstract and, you know, kind of scary, approachable through these. And it kind of opens that door of communication. And it also, because we have a character in our comics, it kind of puts the reader or the client into the therapy model. So that's really interesting as well.
And just to speak to, you know, what I discovered about using comics in this clinics was that the comics really start to elicit a visceral sense from the clients. And that was unlike any form of traditional psychoeducation materials we were giving out at the time. I mean, we tried to use certain very basic graphics on our handouts, but they were full of words. And so this being able to elicit the gut feeling information, particularly because our trauma clients were coming in with sensations and emotions and patterns and thinking styles that were really coded in this part of the brain called the implicit memory system. And that really is the body and the sensory memory system. And so to be able to get in there with these images and actually speak to clients directly through those means was really important. And our clients have shared with them that they just resonate with this material so easily. And also this idea, I think, that Patricia is talking about, that it's, you know, hard to talk about trauma. And so it creates a space for the unspeakable. So secrecy, blame, shame, it creates room for that. Okay, so the next one we'll just tell you briefly, and then we have another moment or here left. This is an example. So this talks about this idea of triggers or reenactments, where there's a divide between the here and now and the there and then. So this is one from the book where we're seeing a character move through the world, trips on something that happens in the here and now, and then falls into the entanglement of the weeds from the past. And even as you see the determination of them emerging and the resilience of them emerging and arriving back into the here and now, they are left with some of the residual impacts, the weeds from the past, so those undigested memories and symptoms. So we'll just share, as we're wrapping up here, some of the surprises and the subjective feedback that we've gotten. And I'll maybe highlight one of these. So this one person said, "I've never felt like I belonged anywhere." And this sounds weird to say, but these models describe me. They tell me why. It's like somehow a piece of paper had the power to whisper to me, "You're not alone." And I heard it. And I really like this one too. We do have some things from clinicians, but I'll read this person who said they've spent 5 decades of their life believing that what happened to them all those years as a child was their fault. That who I am is the cause of what happened to me. And it wasn't until I saw these comics that I could begin to understand and see that trauma was something that happened to me, and that my brain and body responded exactly the way a human brain and body is supposed to react. And so you can see the shame, like lessening the shame in that example. Okay. Thank you for your attention, everyone, and time.
Great, thank you, Lesley and Patricia. Some very sort of powerful examples of what graphic medicine can do that I hope we can talk about more in the Q&A. Next, we're going to move on to hear from Meredith Lee Vollmer, author of Graphic Public Health, a Comics Anthology and Roadmap. Here we go. So Meredith is a communication specialist for public health at Seattle and King County, Washington, and clinical assistant professor of health systems and population health at the University of Washington School of Public Health. She is also on the faculty of the Northwest Center for Public Health Practice. Her comics have been published in The Stranger, Mother, Illustrated Pen, and the American Journal of Public Health. And now we'll hear from Meredith.
Hi. So I'm here to talk about my book, Graphic Public Health, which is a comics anthology of the work that I've done while at the health department in Seattle, Washington, and also work that I've done in collaboration with other artists, a little bit more on my activist side of things. And it also includes some tips for those who are interested in doing this kind of work. And it really all started with a pandemic story, not the pandemic that we are all living through right now, but back in 2008, when I was new in my position and I was charged with trying to help people prepare for what could be a catastrophic pandemic. And back in 2008, I found it really difficult to engage people on this because it was something that was so remote for people. They had trouble getting their heads around it. And so after reading work by Scott McCloud, I thought maybe there's a different way to approach this. And I worked with the artist David Lasky to try and create something that would help people understand that this had happened before and to visualize something which seemed pretty unfathomable at the time. And of course, here we are, and we are all living through it. And what people had a hard time picturing before is now happening. And what has been so interesting to me to observe is how we all have pandemic stories now. Everybody has a pandemic story to tell. And there have been some really amazing comics that have come out. And it really, for me, highlights that I think we're at a unique opportunity for those of us who do public health communications, that people, I think, are connecting through narrative to public health issues. And there's a way in which we can tell more intimate stories, more stories that are approachable and help be more in tune with how people are feeling about public health issues. In the book, there are a number of comics that I share that were done with the health department that really draw upon the explanatory power of comics. And I think, our previous presenters really highlighted that kind of explanatory power. And so here, this is an example of a little mini comic that I did with the artist Amy Camber, in which we were really trying to help people understand the hazards of lead poisoning to kids and really why it's so important to get them tested for lead poisoning. And here, I think comics work really well to help people understand exactly how that exposure happens and how easily it can happen. So we've used comics at our health department in this way quite a bit. But increasingly, I'm interested in some new directions that I'd like to go with comics. And part of that is thinking about how comics can shape how people think about issues as public health issues. And so this is a comic that I did with Mita Mahato in 2019 called Climate Changes Health. And the objective in this comic was really to help people think of climate change as a public health issue. And what I had observed in a lot of the communications that I had seen in our area about climate change was that it tended to be a lot about policy issues, about carbon footprint, about energy solutions. And so in our health department, we were trying to help think about how can we really focus on people and the impact that climate change has on our health every day, make it very personal. And so this is a way in which we were trying to, by using these really wonderful pieces of art from Mita, to make people, like, you couldn't look away because it was so interesting to look at, and then really talk about some ways in which climate change impacts our health that probably people hadn't been aware of or had been thinking about, and really try and engage people. And then, okay, what do we need to do to try and slow down the pace of climate change to protect ourselves? I also feel that as a public health communicator, it's always been hard to help people understand what it is that people in the public health field do, especially at tax-funded health departments. It's kind of incredible right now that people can just throw out terms like PPE and contact tracing. I never thought that would happen. This was a comic that I did in 2017, and we put on our health department's blog, in which we were going through a mumps outbreak, a pretty sizable mumps outbreak at the time. There was a lot of other work that was happening in the department. So this is an excerpt of that, which really tried to share the magnitude of work that we were doing. And the punchline that comes later in this comic is about, like, we're dealing with so much right now. And if there was a really big thing that happened, we don't know how we'd be able to deal with it because our resources are already stretched so thin. And of course, that is exactly what's happening now. And so this is a comic that I did to try and help explain what we do, and also in a subtle way, really try and press the point a bit about the lack of resources and what that does to a health department and what the consequences might be. And so this brings me to comics that we have used to talk about policy change. Some of this goes more into advocacy and activism that I've done with a community of artists really here in Seattle. And this is a comic strip that came from a project in which we took comics journalism to a giant free clinic that we had been holding once a year, that for 4 days there was free medical, dental, and vision care. Thousands of people show up, thousands of people wait in line for hours to get this care. And so as comics journalists, we went on the floor and interviewed people about why is it that they're here? Why are they willing to wait in line for hours for this? And what we were really trying to do is show just how many people and the breadth of people who showed up to get this kind of healthcare, and how it goes beyond what I think a lot of people assume about people who go for charity healthcare. And to show, like, there's a lot of people who are employed, they have families, like this man shown here. They are underinsured, so he doesn't get dental, and that has a huge consequence on his health. And that it's a problem, not just of people who are experiencing homelessness or people who are unemployed, but lots of people struggle every day in the United States to get the healthcare that they need. And so we hoped by having a collection of these stories, it would get beyond any one individual, but really show how massive a problem this is. And as a way of highlighting that, even with the Affordable Care Act, that we still have so many gaps in our healthcare system that need to be addressed. So this is an example of how we've been using it to talk about policy change. And so, this is a direction that I'm really interested in heading in, how we can talk about public health issues in a way that makes them more intimate, that helps people connect to them, helps people have empathy and connection for the people who are impacted. Because I think a lot of the times when we're trying to communicate about public health policy, it tends to be, it's population health, it's wonky, it's complicated. But if we can present them as more personal narratives that can draw people in, what I'm hoping is that, by building on that empathy, that it will help people get behind some of the public health measures that need to happen, get people thinking about why these things matter for all of us and why it's important to support things for your community, even if it doesn't really involve you or your personal health. And so here I wanted to end with a comic strip, which I think is sadly connected to what's happening in our country right now. This is from 2018. There was a group of us who were parents and teachers and also comics artists who put together a collection of comics about gun violence at schools. And it was from a series called Lines Drawn. And so this is one that I did really to express how I was feeling. So again, a much more personal narrative about a public health issue, trying to link it to what kinds of actions need to happen at the policy level. And again, by presenting this as a collection, kind of getting people thinking about it from some different angles. So the graphic public health book has my discussion about these comics and a lot of more comics featuring other artists. And also I did include a chapter because I get a lot of questions from people about how can I be doing this? Maybe you're not even in public health, but you work in public information. And I think that creating comics for public information is kind of a different thing because you have different kinds of objectives. And the way in which you want people to be left with a message is kind of different than other forms of comics. So there's a chapter at the end that gives tips that I've learned along the way in making these kinds of comics. And I will pass it to the next person.
Great, thank you, Meredith. And now we'll move on to the authors of the next book, Clinical Ethics, a Graphic Medicine Casebook, which is authored by Kimberly Myers, Molly Osborne, Charlotte Wu, and illustrated by Zoe Shine. So Kimberly Myers is Professor of Humanities and Medicine and Distinguished Educator at Penn State College of Medicine and Program Director of Schwartz Center Rounds for the Penn State Cancer Center. Molly Osborne is Professor Emerita of Medicine at Oregon Health and Science University and VA Integrated Ethics Program Officer. And Charlotte Wu is an internal medicine physician and founder of Harness Health Global. And I'll turn it over to you guys.
Thank you, Brian. Here is the cover of our book. And the way that we have envisioned sharing our 10 minutes with you all is that we'll talk about who we are and give our origin story with regard to this project, and then take a look at some panels from 3 of the 8 comics that are included in this text. And then also at the very end, talk about where we see this book going and our intentions for its use. So here we go. This is who we are and where we are in the universe. My name is Kimberly Myers. I'm in Hershey, Pennsylvania. I'm a teacher by passion, a literary scholar by training, and currently a professor of health humanities, medical humanities, graphic medicine at the Penn State College of Medicine. And I'll tell you how this project was born. Molly and Charlotte and I were at a residential retreat for leaders in healthcare that was held on Cape Cod. It was called Courage to Lead. And we, by sheer chance, were put in the same triad the very first evening that we met. And it was wonderful chemistry. And fast forward about a year, and we're back in Cape Cod for the 4th time, and we're sitting over coffee talking about Molly is an ethicist, Charlotte loves visual art, I do health humanities for my work, and we thought, let's do a comic on medicine. And that's how this project was born. Molly?
You have to unmute.
Thanks very much. So I'm Molly Osborne, an intensivist, pulmonologist, researcher, and ethicist at the Portland VA Medical Center. And much of what I did in the intensive care unit just lent itself to ethics. I was previously an associate dean for student affairs at Oregon Health and Science University. So as Kimberly's already said, I came to Hershey as a Doctors Kinley Center visiting scholar in 2017, and the book evolved from there. Thank you. Charlotte?
Hi, everyone. I'm Charlotte Wu. As Brian mentioned, I'm a general internal medicine doctor. I really also have an interest in innovation and creativity in medicine, which led me to my current work in health technology innovation based in London. But go back a couple years, I had been on sabbatical from my prior role as the primary care medical director at Boston Medical Center when I started exploring how could I combine my passion for doing art and delivering health. And this journey led me also to Penn State College of Medicine as a Doctors Kinley Center visiting scholar to work on this collaborative book project we're excited to launch today. But in the beginning, we knew we would need to work with a professional artist to build from my early simple sketches for our first comic Critical Space. So while we were working together at Hershey, we connected with the talented artist, Zoe Shine, who became the illustrator for this book.
So in the images that you're about to see, we're going to talk, as I said, about 3 of the comics, and each one of us will discuss a personal connection to the image that we've chosen, how the work has played a role in our past, current, and future work, and also we'll tell you a visual metaphor. We constructed the book with so that each comic had a visual metaphor. and we'll talk about those as well. So this is the one I chose. It's called Scaling Suspicion, and the ethical issue at play here is mandated reporting of child abuse. I chose this because two of my family members, my stepdaughter and my sister-in-law, are pediatricians, and they're confronted often with the need to consider abuse and neglect. And as we all know, there are very specific rules and laws about the need to report suspected abuse and neglect. And that sounds straightforward, but in the cases of very proficient and sensitive pediatricians, and most of them are, the issue is what happens with what we do here. I will also say that that in the back of my mind, you all will recall in 2011, there was the Jerry Sandusky abuse at Penn State University. And of course, that's the main campus for the College of Medicine. And so those things were in the back of my mind. So I chose this, which is the end panel, almost the end panel for our comic on mandated reporting of suspected abuse. And what this shows is, again, the abuse is considered. If we do report it and there is abuse, then the child, Hannah, who is on the lower right, and her sister are protected and they're glad. The parents in the background are furious. But going across row one, if we don't report it and there's abuse, then we're going to see Hannah in clinic over and over again. And how much can this child withstand? Going down, if we do report and there's no abuse, what kind of trauma can that cause the children? And here you can see that. And then if we don't report and there's no abuse, then the relationship between the much beloved pediatrician, who is named for my stepdaughter, by the way, and Hannah is left intact, so that there is always a trusted advocate for the health and safety of these children. The visual metaphor that we chose here is, you don't see it in this image, but it's a thermometer. So we talked about the raising and lowering of our suspicion, and that was sort of a guiding visual to represent what we're talking about. And in terms of the future, we are delighted with the publication of this book, and there is a second book in the works that's going to do international ethics, so broadening to a global community. So thank you, Molly. It's your turn.
Thanks, Kimberly. And as the next picture comes up, you can see that the metaphor is the swan. It's quite visible. But let me tell you the story about the swan, because it's a true story, and it's really reflecting the importance of communication at the healthcare medical level. And briefly, I was in the intensive care unit. I was in a hurry. I was rushing around, and I needed to get permission or consent to put a very thin catheter in a patient's neck. But the name of the catheter is named after the physicians who developed it, called Dr. Swan and Dr. Gans from Southern California. So it's often called colloquially a swan. So I rushed to see this patient, asked for permission to put a swan in his chest. And you should have seen his eyes bulge. So this became a really important metaphor for communication. And needless to say, at the moment, I slowed down, sat down with the patient, explained what the procedure was, got permission. It actually went well. I was very pleased. But I continued to tell the story and was happy to put it in a comic format because it emphasizes how important accurate communication is in medicine. And I've shared this story with each entering medical school class in my role as Associate Dean for Students. And then now going forward, I actually use these kinds of stories in my plenary to facilitators in an annual Northwest Narrative Medicine training. They're really useful symbols that help people talk, as has already been pointed out by Lesley, Hughes, and others. It really helps people open up to their visceral feelings around what's going on in medicine. And I'll talk more about that in a minute. I think it's over to Charlotte now. Thank you.
Thanks, Molly. So So here we see some of the last panels of our story, Broken Speech, which is a composite story drawn from experiences that I've had over the years, both in taking care of patients, but even in my own community and family. And the situation is when families of patients haven't wanted to tell them about their own diagnosis to, for instance, protect them. We try to capture the nuances of cross-cultural communication, in this case, the story of Mr. Ito, who is of Japanese background and living in the US, with, if you see on the left-hand panels on the top and middle, these overlapping dialogue boxes, which are rounded when it's in English, with the square corners when it's in Japanese, to show what was said in both languages and how that can be overlapping or sometimes different. I just wanted to share the other inspiration for this story, which was a real patient of mine, an elderly Taiwanese man with end-stage prostate cancer, who was having a very tough time with many rounds of chemo and radiation, and one day made his wish known. He didn't want any more treatment, and his biggest wish was to go back home to Asia to see family and friends. When he returned, he and his wife came in for a clinic visit with me and presented me with a lovely hand-painted vase. He said there was another matching one, but it broke on the way back on the plane. He tried to repair it with glue, but his wife said, I probably wouldn't want it. It's broken, but would I? And I said, of course. As a side note, then he turned to his wife and said, see, I told you she'd want it. And this story, we thought, beautifully captured the Japanese concept of kintsugi, which is one of the metaphors in broken speech, which is the art of putting broken pottery pieces back together with gold, and builds the idea that to embrace flaws and imperfections, you can create an even stronger, more beautiful piece of art. So our intention here is that a story such as this one can inspire reflection and conversation on the ethical concepts such as autonomy, while also shining a light on the art that it truly takes to be a compassionate healthcare practitioner. Passing back to Kimberly.
Yeah, and we'll go back to the cover. So the very last thing that we'll speak about is very briefly our intentions about how the book can be used. I led with the idea that by passion, I'm a teacher. I've always been a teacher. That's my calling in life. And so we have for each comic questions or ideas for further consideration, so that this is very, very practical in the classroom. And we envision this as practical for really any level of learner. Certainly, it's going to be incorporated into our medical curriculum next year. We just did in a class, in our first year class of medical students, a session on advanced care planning. This book came out too late to be used, but it would have been perfect for that session, because it really clarifies what it means to have a proxy, at what point a proxy is brought into the discussion. And then just looking forward a year from now, I and a medical anthropologist are taking a group of students to England for the summer, and we are going to be using this as our text to teach them clinical ethics. Charlotte?
And I'll just say a quick note to say, we also intend that this can be a unique tool for nurturing interprofessional education and team building. And in sessions I've used, the comics have really broken down communication barriers between very different healthcare professional roles. So people talk more about the situations they're facing together, and they can find common ground.
And this is Molly, just to finish, I use these stories often at conferences, and the quick story is going into a group of surgeons. It could have been a group of anyone who's been on call, any providers that are exhausted. They're all looking at their iPhones. I have an hour to talk about that. So I show them one of the comics, and the next thing you know, they just lit up, because each had a story that fit with their own experiences in the intensive care unit. So as a device for people to tell their stories of moral distress, grief, and fertility, as well as education, these have been highly successful. Thank you.
Thank you.
Great. Thank you, everyone, for those overviews of your respective books. I'll just echo what I've seen in a few chat comments about how wonderful all three of these works are. I've had the chance to get my hands on all three of them, look at them, and I could easily sort of foresee myself using all of them in various sort of scenarios in terms of teaching, on the wards with trainees from all different professions, as well as levels of training. So they're all wonderful. I encourage all our participants watching now to sort of go and check these books out, because I think they're very welcome addition to graphic medicine and really show what graphic medicine can do. So with that, we'll open it up for questions. Again, I want to encourage everyone, if you have a question, to submit your questions to the Q&A, and we'll try to get to as many as we can in the next little less than 20 minutes or so. But I'd like to start by asking a question that I think echoes a little bit of what Sarah Levitt said about process of making comics. So I was excited to see chapters in two of these works, so the Looking at Trauma and the Graphic Public Health, that focused on the process of making comics, particularly collaborative comics. And so Meredith and Patricia, if you could elaborate on why you included those comics in your respective books.
I assume you're why I included the collaborative comics.
Well, why the chapter on the process of making the comics?
Yeah. Well, I think, I really wanted this to be a book that could be used by people who work in public health, and also, my colleagues in public information, because I think there's a lot of interest in doing this kind of work, and I think people are ready to think in more narrative storytelling ways, but just don't know how to get started. And I didn't know either, in 2008 when I worked on the No Ordinary Flu comic book. But I'm fortunate because, being here in Seattle, there is a very strong and welcoming comics community, indie comics community, that took me under their wing and taught me a lot. And without them, I don't know if I would have been able to figure out, how do you find artists? And how do you distribute this kind of work? How do you even get things printed? I learned a lot, but I also feel like, as a communications professional, I do know a lot of other things about messaging, about how do you craft public health messaging, and then think about it in visual terms, that I thought would be helpful. And also, how do you develop scope of works for artists, the real practical nuts and bolts. So I thought, if I can share it, because I want to see what other people produce, I think this could be super exciting. So I just wanted to help in that way.
That's super interesting, Meredith. Yeah, for us, I think because we were making a book, we needed intro chapters as well to present the content. And one of the fast answers is that personally can't write. So my introduction would naturally be a comic. But also, since this book was supposed to be a clinical tool, and it's not like comics are a very popular tool, right? We wanted to kind of bring the reader in to explain how these comics were made. And especially as a medical illustrator too, I always have to kind of explain my job. So that's just part of the process of, validating the use of comics in the clinical space. And as well, I was talking to Lesley about this yesterday, and it's kind of poetic in a way, because therapy is all about the process. So it's only natural that the book would also reflect that process of making it.
Great, thank you. Moving over to the Q&A, again, please put your questions in, then we'll try to get to them. So one participant asks, how do these comics get in the hands of needy patients or other target audiences? With a follow-up question of whether there are mechanisms to measure effectiveness. And so I'll open that up to the group.
I can start by responding to say thank you for your question. And right now, so our Looking at Trauma book has been written and designed as a clinical toolkit. And so we are wanting to get this in the hands of clinicians, healthcare professionals, even educators, teachers, whoever it is, so that they can actually directly engage using the comics and the book with clients. And so the way we use it in our hospital setting is in group and individual psychotherapy as well, through sharing the visual metaphors, describing them, and then having people share their own subjective experiences in the clinical setting. Right now, to the second part of the question, we don't have a way. We measure our groups and our individual therapy effectiveness, but we don't have kind of a standalone program yet designed around using the comics in the book, although that might be a good project idea for the future.
I can speak to the second part of that question. In the graphic medicine community, there is work that's currently being done to measure a graphic piece, a graphic novel or graphic pathography, as it's used to actually implement it in a clinical setting. So I'm part of a group that's doing that with a wonderful comic, a book-long comic called My Degeneration. It's about a person's experience with Parkinson's disease. And so a team of neurologists and graphic medicine people and staff came together, and we actually did a mixed method study of the use of that comic in with the providers, and we published on that. And we're currently in the second phase, the second arm of the study, where we actually used it to with patients and how they found it helpful or didn't. And then the third arm is going to be how to use it with family and friends who are carers for the patients. So that's one thing in the graphic medicine community writ large that we're very, very interested in doing, is to, finding out the answers to how effective are these things. Thank you.
Anyone else want to tackle that question?
I can speak to distribution of comics to public health audiences, because there we're dealing with a lot of different types of audiences. And so there's different ways in which we're working to get the comics out. I just happen to be proofing a print run of our little, Comic Changes Health mini comic there. And so we try and think of, as we're developing comics, what is going to be our distribution and how do we reach the audiences we're targeting. So sometimes that's through community organizations. We do a lot of translated comics right now, particularly right now we're doing a big distribution about the impacts of heat. Unfortunately, in the Pacific Northwest, we experienced some really devastating heat last summer. And we have comics that talk about the hazards that we developed in talking to different communities about what do you do to stay cool. We know that there are certain communities where there's poor housing quality, where there's fewer trees in their neighborhoods, all the things that we know about health disparity that impacts certain groups more than others. So we think about how do we get those comics to them. So we work a lot with community partners, with libraries, having them in different community health clinics. And then we also use our very public means through, we have a blog for our health department. Really thinking through that distribution element is really key.
Great, thank you. And I'll just sort of point out a comment in the chat by Matthew No, just about when we sort of talk about effectiveness, the important question does come up is, effective at doing what? I think, a lot of us in this community recognize that comics do a lot of work and a lot of different things and are effective across a spectrum of different things. And so, but in academia, we're often asked to sort of narrow that down, and that can be quite challenging. But one thing that I think is really exciting about all of these works is the fact that they're sort of collaborations, and in sort of recognition of more of the collaborative work that's being done within graphic medicine. The question came up of if you could talk a little bit about the challenges of doing collaborative work across different fields and spaces. So how does one navigate these tensions at various stages? And that can be opened up for all of you.
I can answer that a little bit. As a medical illustrator, we always have to work with, it doesn't mean we have a medical degree, just means we can understand and research and have that understanding of the science or the content. So we often work with clinicians, doctors, researchers. So I think it's just about our job as communicators is to take their words and make it to something that is approachable and understandable. So I think we can use strategies of like, what is their core message? Like what we ask like certain pointed questions, like why are you making this video? Why do you need this explainer video for said, for example, like diversity in clinical trials, right? Like what is the message in this point? And taking all these things and taking your intent, and then it's our job to craft that message. So just helping people guide and talk to them.
So I'm Li Osborne, and I'll make a quick comment. So in the presentations with the Northwest Narrative Medicine training, we actually try to have not just the healthcare group, but the entire community get together. Well, pre-COVID it was get together, now it's with Zoom, to actually discuss how to share our human experiences across many, many different kinds of systems, of which graphic medicine is only one. We could previously get people together to do their own drawings. We could have them tell their own stories and really make the point that we're all in this together, community and the many different providers. And so by opening it up that way, with ground rules of acceptance for all and equity for all, you might say, it seems to have worked quite well.
Anyone else want to speak to just sort of working together and collaborating? Maybe some of the challenges in particular.
I've done a lot of collaborative work because it took me a while to have the confidence to, frankly, draw my own comics. But it also gave me a really great, a lot of mentoring from a lot of artists that I've worked with. And so I think, typically because doing public information comics, there is a particular message that I want to make sure it gets conveyed. And so I typically work with our subject matter experts and do the writing, but then I meet with the artists, and I find that oftentimes the artists have really ways that they're thinking about it visually, where I really encourage them to make their suggestions on how, do you think this is going to work? How can we adapt this further? And so I find that we always come up with a much better comic as a result of, having back and forth. They often make suggestions on the writing. I'll make suggestions, from the art direction point of view, and I feel like it always comes out stronger that way. I also feel like we've done some group collaborative projects where, everybody's developing their own comics and they come together as a collection. Love doing that because I think, everybody comes at it from different angles, and I think it's very rich. So I think mostly it's kind of an organizing function that is the greatest challenge, and just figuring out, how to bring everybody together and really complete the project. So it's more project management.
Kimberly, your hand's up.
Yeah, so I would just say the importance of having an expert in any domain that you're working in. So Molly was our ethicist. She's a clinician. Charlotte is a clinician with an internist perspective. So that's really important. But another thing that's hugely important that may be underrated is that the members of a team really should be quite different from one another and have different interests and different skills. Some do better with the gestalt, and some do better with the granular details. And we found that toggling back and forth that Meredith was talking about was really super helpful and essential. and we all brought our strengths in when they were most called for. So making sure you've got a good team is really important.
And I'll just add one more note, maybe on the tactical side of this this question. Our collaboration started well before the pandemic. At the same time, I do think that many of the challenges we've all had to navigate working with our teams remotely now give us more skills for doing collaboration, but also in the graphic medicine space. So for instance, we've had to be very intentional about how do we annotate? How do we make sure we're talking about the right things? Are we sharing screens? Right? So a lot of the how do you do collaborative work from different places, as you see from our map, it was from different countries. So I think those come into play, as well as being very organized and open in terms of letting people share their different I guess, opinions and thoughts and basically contribute, such as Kimberly was saying, because we all brought different perspectives. So I think those skill sets that we've all probably nurtured along the last couple of years are extra helpful also for graphic medicine collaboration.
Great, thank you. And we're running up against time, but there's one more question in the chat that I want to get to. And the question is, at what point after trauma is the use of graphic comics useful in helping the victims? And in particular, the questioner was sort of thinking about children who have survived mass shootings. And Lesley, I'll let you take this one.
Thank you. That's a great question. I would say, just in terms of the work that we do in trauma, we use a stage-based approach. So we're really focusing on those initial stages on safety and stabilization. And in terms of the Looking at Trauma book, I would say that there are certainly resources and comics that you could use immediately in the wake of something like a school shooting, particularly as it relates to resources. So Patricia's done a beautiful self-care and resourcing comic that's really full and of images that can help be reminders around grounding and that kind of safety and resettling. And then later on, there's also some models around affect regulation. And what I will say is we've been most surprised that the general use of these comics, I know I've pulled them out, I'm guilty of pulling out the book at a family barbecue and somebody's telling me about some kind of feeling they're having. And I'm like, oh, look, you're just outside your window of tolerance. We can get you back in. And with my own kids. So there's a lot of generalizability, I think, across those models. And hopefully they can help after in the wake of a major trauma.
Okay, so we are running close to time, unless we could take maybe another question real quick that I think is sort of important when we're sort of talking about these works. And someone asked the question of, how do you think about protecting sort of personal or private health information and patient identity in the context of the comics that you're creating? And do the patients know that their stories are included if they are more kind of one-on-one rather than composite stories?
I can speak to the comics project that we did at the large free clinic, that one of the reasons why we wanted to use comics was because it allowed people to preserve some kind of privacy. So I did a training with all the comics journalists. And so there was kind of a procedure we went through in terms of explaining what we were doing and then asking people, in the process of asking if they wanted to participate, that they could change aspects of their identity, that it didn't have to look like them, that we didn't have to use their real names, because what mattered in this project was that we share the experiences that people have, but it doesn't have to be linked to them as individuals. And it allowed us to be able to share the stories. When I was working on them, I also tried to see if they would allow me to contact them afterwards and share it with them to make sure that I had their permission to use it.
Anyone else want to tackle that question about sort of protecting patient identity?
I will say quickly that I did not reach out to the patients for the stories at least 3 decades old. So that was not an easy thing to do. And yes, we did change a lot of the aspects. This is a shout out to Kimberly, who was very careful about making sure that there was appropriate diversity across the various characters of the comics, and of course, anonymous information as well. And very generic issues. Yeah, but it's a really good question to think about. Thank you.
I'd say for us, it's all composite. So it's like years and years of experience kind of put into one and nothing really specific in our book. And each of the comics has an accompanying chapter by a clinician who has kind of written about their experiences or questions to ask to help the clinician explain things. So nothing specific there.
Great. Well, seeing that we're a little bit past time, I see there are a few questions that sort of point to how to get involved with graphic medicine. And I would just say to go to the graphicmedicine.org website. That's just a great place to kind of start and to see what the field's about, to see what conferences are happening, to just see reviews of things and just really get a good sense of what the field is about. And certainly reaching out to any of us, I think we're all more than willing and interested in sort of expanding the field. So do not hesitate to email any of us as well. And certainly take a look at the Penn State University Press Graphic Medicine series. That's also a great place to start to sort of look at what the field is about. And again, these books are wonderful additions to that series, and I encourage everyone to read them. We couldn't get to all the questions, but the good news is that if you've enjoyed this conversation about these books and want to continue the discussion, join us at the upcoming annual Graphic Medicine Conference, which is going to be held here in Chicago, July 14th to 16th, where a number of these authors will participate in an authors panel. So this discussion is certainly to be continued. I just want to point out that registered attendees will receive a follow-up email with links to all 3 books, as well as a special discount code for 40% off. So now is your chance to buy these works. And if you would like to find out more about virtual events, as well as these wonderful books, please visit the Penn State University Press.org and follow the press on Twitter and Facebook. And with that, I will say thank you to all of our authors and thank you to the participants.